For Module 2, we are discussing what is meant by the phrase time is muscle. My name is Amy Coltrrane, and this is my submission for the discussion forum. To understand this, we have reviewed the circulatory system, and in this case, particularly the heart. On page 139 in our textbook, Pharmacology Connections to Nursing Practice, we reviewed that the heart is comprised of specialized muscles, and this is referred to as myocardium. The myocardium consists of cardiac cells, and the important thing to know about cardiac cells as far as time as muscle goes is that these cells are incapable of regenerating. So once a cardiac cell dies, as part of the myocardium, that area of the heart muscle eventually becomes scar tissue. In our readings, it said that it starts out as granulation tissue and it takes 2 months for it to become scar tissue. Because the heart works like a well-oiled machine, each area needs to do a specific job at a specific time. And having portions of it die and turn to scar tissue can create all kinds of problems, from dysrhythmias to death. Also, metabolites build up in toxic levels in the blood. They're left in the heart if all factors such as stroke volume and cardiac output are not as strong as they need to be. And of course, if part of the heart has died and is becoming immobilized, then everything is not going to be working like it's supposed to. So those toxins can build up. One example of this is potassium that is given in our reading from Medscape, the myocardial infarction article. And I usually am asked by my patients, I work on a pulmonary unit, and I'm usually asked by my patients why we are checking things. One of the things they ask about is potassium, because most people are familiar with potassium in some way. They've come across that term, and they think that they have an understanding of it, and they're puzzled by why that's being tested in the hospital. And I usually try to explain to them that, you know how you get a leg cramp and people say eat a banana, it's got a lot of potassium in it. That seems to be something that most people have heard at some point in time in their life, and they understand that. And I will go on to tell them, well, your heart is a muscle just like your leg is a muscle, and it can get a cramp too. But a cramp in the heart muscle is called a dysrhythmia. And they can be very dangerous, and that seems to help patients understand the importance of potassium and electrolytes and things like that to their hearts, and why we're checking certain things in their blood work, usually every day while they're in the hospital. Acute coronary syndrome is something that refers to STEMIs, non-STEMIs, and unstable angina, and these can be thought of as degrees of blockage from plaque buildup in a coronary artery, beginning with unstable angina and progressing through a non-STEMI, which is a total blockage. This can be thought of or explained to patients like when your kitchen sink drain gets clogged. However, when the parts of the kitchen sink drain don't drain, they don't actually die, which is what happens in the parts of the heart if there's a clog in the flow. The treatment for acute coronary syndrome is to get the drain unclogged, so to speak. So one way is to use thrombolytics. However, these are only good in the early stages when the clot or clots are active, and it needs to be given within 30 minutes of the syndrome symptoms, and they're of no use after 24 hours. That's one of the reasons why it's so important for people to know what the symptoms are of having a heart attack or a problem with their heart, because the quicker that things can be done, the better off their heart is going to be. These thrombolytics carry a significant risk for bleeding, and the specific medications that are used are called alteplase, tenecteplase, and streptokinase. We actually use the alteplase pretty commonly with PICC lines in the hospital that I work in if there's a clog on a PICC line. If it's not flowing, if there's no blood return, that's one of the things that's used to get the PICC line flowing again. We'll put the alteplase in it, and then it is left in there for a certain amount of time, and then there's a procedure that we have to follow to try to get the PICC line unclogged. The best practice, however, is percutaneous coronary intervention, and that's commonly referred to as balloon angioplasty. And that is where a medical balloon is inserted through the coronary artery, and it clears the clog, and it opens it back up for the blood to flow through freely again. This procedure is done in a cardiac cath lab. So time is muscle refers to the amount of time it takes to get blood flow back to the cardiac cells. Every second counts because those cardiac cells that die will not be regenerated. Therefore, the less time it takes to get things flowing again, the less cardiac muscle will be killed off. And the more time it takes, the more cardiac muscle will die. Evidence-based practice has shown that the odds of a patient surviving acute coronary syndrome when the clogged artery is cleared within 90 minutes, with 60 minutes being the ideal time. And there is an interesting article that I found online from Johns Hopkins University Hospital called "Beating the Clock," and it talks about the importance of getting the artery flowing again as soon as possible and refers to time as muscle. One scenario that it discusses is a case where the cardiac cath team is not at a hospital 24 hours a day. Some hospitals they are, and in a lot of smaller hospitals, there's not going to be a cardiac cath team there at all times. But one emergency room took the initiative to build an emergency room team that's like a pre-cardiac cath lab team. They go ahead when someone with acute coronary syndrome comes in, they go ahead, they get the machinery turned on, they get the EKG done, they even get the patient draped, they get all the machines turned on, going, any pre-test that can be done. They do everything that they can while the cardiac cath team is en route to the hospital. And they found that they shaved 20 to 30 minutes off their door-to-balloon time. So that was considered a great win for that hospital and set a precedent for a lot of other emergency rooms across the country. And that's all.